skull base tumor is defined as a tumor that is occurring in a specific location, often at the base of the skull, hence the name skull base. And that implies a more difficult case. Generally, there are a lot of nerves and arteries that course around the skull base and the foramina, which are the holes that the cranial nerves and vessels exit. So it requires a special expertise. And we're lucky, again, that here at our institution we have several doctors that actually have a training and aptitude in skull base tumors. Before we would do very extensive exposure to these tumors, we now have a minimally invasive option to accessing these tumors, specifically through the nose or through the base of the skull. So we use the endoscope, and in fact our ENT surgeon gives us access to that area, and then through the scope we can actually remove the tumor from small openings at the base of the skull, and that actually saves the patient from having a large scar on the scalp. The goal of the surgery is to remove bone and structures at the base of the skull to minimize the manipulation of actual brain tissue. And just by doing that, it improves recovery by reducing brain swelling, reducing confusion after surgery, and so the patient's length of stay is generally much less than doing an open skull base approach. Obviously, there are some cases that do require the open approach, and sometimes you actually have to do a combined approach, both minimally invasive and open. But by doing it this way, the patient has a smaller incision that's actually hidden in the nostril. Risk of infection is actually lower, risk of brain swelling is lower, and days in the ICU is also reduced overall. So it's a very useful option to have, and one that we've used more and more of late.